Thank you everyone for joining us for today's webinar. My name is Natalie Rodriguez and I am with the Forensic Technology Center of Excellence, a program of the National Institute of Justice. Before we get started, I will go over how you can view and interact with today's webinar. The first thing I'll draw your attention to is the chat pod, which is located on the right-hand side of your screen next to the player window. The chat is the best way to communicate any questions you have regarding today's material. All questions will be retained until the Q&A session after the presentation. The chat is also the best way to let our support team know if you are experiencing any technical issues. Simply post a short description of the issues you are having and our audience support team will assist you. If for some reason you happen to lose the audio or video during the live stream, the first thing you should do is refresh your web browser and then click the play button in the middle of the player window. If this does not work or you experience any other technical issues, please use the chat to notify our support team. You can also contact us with any customer support issues with the FTCOE toll-free number or email address located directly above the player window. We will begin today's webinar shortly, but first, please take a moment to type your location into the chat so we can get an idea of where everyone is joining us from today, as well as confirm that the chat is working properly. For today's webinar, we have Matthew Gamet, Riley Nowlin, and Sherry Craig from the Idaho State Police Forensic Services presenting on the sexual assault kit evidence tracking the Idaho State Police Forensic Services experience. Without further delay, here are Matthew, Riley, and Sherry.
Hello and welcome. My name is Matthew Gamet, and I'm the Laboratory System Director for Idaho State Police Forensic Services. I have with me Ms. Riley Nowlin, who is the Laboratory Manager here in the Meridian Laboratory for the Laboratory System, and Ms. Sherry Craig, who is our iKits or our Idaho Kit Tracking Administrator here for Idaho State Police. Today we want to talk about the implementation, functionality, and compliance of a sexual assault kit tracking system implemented on a statewide basis. So in about 2014, we were not exactly sure on the statewide basis how many kits we had in our state. We knew places like Detroit and Los Angeles had a lot of kits that they were identifying. We just weren't sure what our issue was. So we did an informal survey about 2014 of our law enforcement agencies and clinics and hospitals to see how many kits we had in our state. And quite frankly, that wasn't a very successful audit because we were not legislatively mandated to be able to do that audit and really have no oversight over other law enforcement entities in our state. So there was about 50% compliance with that audit. And so we still didn't necessarily know what the extent was, but we knew we had a problem with the kits that we did find. And so we went about creating a statewide multidisciplinary team to address this issue in Idaho, both tracking on the kits, but also we knew we had issues with collection and other things that were going on. So we wanted to have a steering group, a guidance group, and we looked at all the different entities that we could find to provide us leadership on this topic. So some of the groups we looked at were advocacy groups, hospitals, nurses, law enforcement, the courts. We took all of the obvious stakeholders in this process and got them together and started to meet with them. The Idaho Sexual Assault Kit Initiative was this group. It was initially set up by the Idaho State Police Forensic Services because we recognized the need in this area, but we also recognized that the state wasn't necessarily in a place where we could codify this group or didn't want to codify this group at that point because we weren't sure what it was going to become. So we initially got together and we decided that we wanted to develop some standards in this area for sexual assault response. But there was a lot of kickback, a lot of feedback that we didn't want to necessarily make them standards initially. We wanted to make them guidelines so that we could get buy-in, but also not lock people into a corner. And they could kind of move with us in the group, that we could do the different things that we needed to do until we locked them in as standards. We also recognized a great need for sexual assault nurse examiner training. Although we didn't have the resources, we recognized that there were many areas of our state that didn't have access to SANE nurses or any nurses to do the collection. We recognized that a lot of our local communities didn't have SART teams. The law enforcement in our jurisdiction, in our state, had very little training on sexual assault response. Any kind of training in this area could be really helpful. And then we recognized that we had a lack of statutes that would do any kind of kit tracking. There was no mechanism to do kit tracking in our state and no oversight for the kit tracking process. At that time, we did purchase the kits at the state lab, but we had no way to track where they were and in whose custody. One of the things that we've determined is really important is having a statewide working group, and that is what ISAKI, or the Idaho Sexual Assault Kit Initiative group, is. It's not legislatively mandated. It's a group or a coalition of the willing. I won't go through and read each individual participant here, but I'll highlight some of the contributions. We have legal representatives, legal professionals, so people from the courts, prosecutor, public defender. All of these individuals are looking at this from the perspective of the courts. We have victim advocate groups, both community-based that work with the victims, survivors during collection, and also law enforcement victim witness coordinators that work with them as they go through the process. Stakeholder groups have been a later entry into this process, but they are taking the data that we're generating and feeding that back into the program. Another important contributor has been the Idaho Coalition Against Sexual and Domestic Violence. They advocate for the survivors, and they have brought a lot of different entities to the table and a lot of interests, but we focus a lot on our underserved populations. So we do have a lot of populations that aren't necessarily being addressed in this process, like our LGBTQ and our Hispanic populations, and those underserved populations that we have specific to our state, some in general. But we try and address those populations by bringing in experts from those communities to help us understand and address those concerns that are there. We have medical professionals that participate with us, both physicians, some that are SANE nurses, SANE A certified nurses, others that just participate in the hospital. We want to make sure that we're doing a good job of doing the collection, and we've dedicated a lot of resources to these individuals and entities, but understanding their needs and their participation in the process is vital. We have many state agencies that participate. The forensic lab obviously is a huge part of this as we process all of the kits, but we've brought in all of the grant partners, statistical analysis partners, Department of Health and Welfare that deals with a lot of health type issues. And we also have our Council on Domestic Violence and Victim Assistance, which has a lot of access to grant funding. All of these partners come together, and I should have mentioned as well our FBI and our tribal police so that we can address the tribal issues that we have in our state. We have several tribes, and we try and be very cognizant of those issues that they have that are unique to those populations. All of these groups are very highly collaborative. One of the most collaborative groups I've ever participated on. They get things done. They look at laws, they vet through all these kind of things, and they make sure that our state is addressing these issues very well. We have in this group addressed a lot of different things in statute. And a lot of those things came about with the statute 672919, which is referenced on our website if anyone's interested in looking at it. It's done things like it defines a sexual assault kit in our state. It gives us the ability to purchase those with legislatively authorized funds here at the state lab so we control what the intake of those kits are into our state. It also mandates that we report out on database entries that we're making in the DNA database and also hit tracking, so that we can really give the community, give Idaho citizens a good idea of how many database hits we're having and that those hits are being followed up on by law enforcement. It establishes retention dates for these sexual assault kits, and our state has some pretty robust guidelines here, or actually statutes here in this area, 55 years retention required for most kits. And that was something agreed to by law enforcement, by the laboratory, by all the different stakeholders coming out of this ISAKI working group, which was really important as we developed legislation, that everybody was on the same team. It also establishes these timelines and time limits for the testing to be done, how quickly a clinic or hospital has to submit that to law enforcement, how quickly they have to get it from law enforcement to the lab, how long it takes us in the state lab to process those things. All those timelines are established by legislation. And there are two exceptions in our state for why testing would not be required. There was a more expansive list, And then that legislation was tightened down when we recognized that the initial legislation was not working in the way that we thought it would or that it should. And so now it's really two limitations that we'll discuss later on why a kit would not come into the state lab to be tested. Destruction is a really important element. We understand that the survivors in these cases have the right to know when their kit is going to be destroyed or disposed of. And so that is all built into our kit tracking system and the notification process. Then we also mandated that the Idaho State Police, that our entity here, would create a sexual assault kit tracking process and that we would track those kits. We decided in our state to go back and track all kits, any that we identified in audits. And so we may not know of some that have been destroyed in our state that were destroyed before the kit tracking process, but going forward, we should know about any kits that existed in Idaho starting in about 2016 and moving forward until today. The statute also, it outlines the responsibilities of various entities, of law enforcement to retain the kits, of the state lab to process those kits. So having a statute in place, which I think ours is a good one, it's been negotiated by a lot of different entities. The state legislator that was in charge of running this legislation was very collaborative and helped everyone to see the value in what we were doing and collaborate and come to the table. Some things to consider. IT costs were not significant for us. It took us several months to develop this system. But you have to consider these things if you're either procuring a system or developing it in-house. We do have it hosted on our servers, so we have to maintain the software. We have servers that we have to maintain here. We did hire a full-time position to do the tracking. And that person is pretty busy doing follow-ups, answering emails, phone calls, and things like that, making sure that the users are correct in the system, all of those kind of things. And then we do a lot of training for the users, both live and on demand. We host classes. We go out to their sites and help them. And they can always, if they're a new user, go and look at the content that we've developed and put on our YouTube page. There is a need for security. One of the considerations that we looked at early on was making sure that the system was secure for survivors. We didn't want to re-victimize them by putting their name, their phone number, email address in this system. We know that we will get hacked. Everyone's going to get hacked. It's just a matter of time. And so we wanted to make sure that if we got hacked, there was no information in the system that would lead to these victims, these survivors being re-victimized. We do have notifications in the system. So some of the things that we notify our survivors, we notify them of the steps that happen in the process, but we also notify them of the destruction date for the kit. There's a point of contact for the agencies. So if their kit isn't going to be processed or if something's happened with their kit, there's a contact for them to reach at the law enforcement entity or the prosecutor's office so that they can follow up with that. The value in this system is its ease of use. There is a simple user interface. We worked with all of the ISAKI working group to ensure that it was just very simple, that there wasn't a login required, that nobody had to remember any kind of login information, a password or anything to be able to get their kit information. We wanted it to be simple for law enforcement so that they could go in, they could really keep an inventory of the kits that they had, that if they got an inquiry from the public or from a newspaper, that they had all the information at their fingertips to be able to answer those inquiries. And really, we wanted to make sure it was transparent to the community. That was our overall goal. We wanted to make sure that we could scale the software and scale the database depending on how many agencies we had, how many labs we had. And the software is now very easily scalable to a very large state or a small city. It could be implemented anywhere. We did use a lot of our stakeholders' information and input. We sought their input early and often in the process so that we could really get this right. And in any kind of software that you're considering implementing, you just need to make sure that it's going to work for your entity and really test drive it before you get into it. We did a statewide audit. We did a statewide audit with legislative permission and authority. We are given that ability now in statute to edit or to audit law enforcement entities around our state. But we learned some lessons in that process. First of all, we learned that you have to be an independent entity that is doing this assessment. It can't look like Big Brother coming in to do some kind of assessment, but it's really helpful to do this in person. We were relying a lot on information coming in from people that might or might not have been accurate. We weren't seeing the kits in person, having hands on the kits to write numbers on them. So that would be a really important consideration, that the audit is done in person. Training the audit team for consistency, really having a plan to go in of what you're auditing. Are you putting numbers on the kits and those things as you go in? How are you accounting for these kits, making sure that you don't have duplicate kits with the same number, all of those considerations. This is a very dynamic process. It changes by the minute. And so somehow stopping or freezing the transfer of kits to allow us to more accurately do the audit would be really important. And then you got to move quick, because these are moving by minute. And we need to move quickly so that these entities are not frozen in time and not able to submit to the state lab and do the other things, the investigations that they need to do. We recognized early, too, that law enforcement were having to pull off detectives and others to go back and to research these kits and to look in their warehouses and other things, find out how old was the survivor when this happened, and what is the information on the kit, where was it collected, all of those kind of things. Detectives had to be pulled off of other projects, and so providing resources to them is really important. And then agreeing on the release of the data. What's going to be released? How's it going to be released? Is it going to hit them in the newspaper? The chiefs were very interested in that topic, obviously from a political perspective. They didn't want all this to hurt them. So we needed to be very careful in that kind of consideration and how the audit data would be released to the public. Ultimately, we did decide to release it on our website, and it's currently there. And we do a legislative report every year. Some things to think about when you're on site doing this audit: ask everybody. We've learned the hard way and over time that we ask lots of people, but we didn't ask everyone. And some people would say, oh, well, we forgot about this location over here, or did you think about this? And so asking everyone up to and including leadership is really important. Having an electronic tool for them to put the inventory in and having it be the same. We used an Excel spreadsheet. There might have been other ways to do that. But having the kit tracking system up and going before might have been one way to do that. Unfortunately, we weren't in that situation, but it certainly would have helped. Using unique labels like a barcode or a number, writing a number on those kits so that they could be identified, we found would be very helpful in this process. We found kits way after the fact that did not have numbers, and that became really easy to identify that it was not captured during our first audit. Being on site, again, is really important to do this assessment. Using a label to scan and all those kind of things were great considerations. And putting as much chain of custody information as soon as you can get it into the kit tracking system. We're several years in, and we're still, because we decided to go back and inventory all the kits that we've had in existence since 2016. And those that were on the shelves in 2016 extended way back. Now we're having to go back and recreate some of that chain of custody information off of the kits and off of the law enforcement. So that becomes really important. And you see the take-home message at the bottom of the slide. Do it right the first time. Really think this out, and would be happy to talk to any of you who are thinking of doing it to share some of the other lessons that we learned. So what's the value? Well, we can provide a lot of transparency to a lot of people. We're providing access to survivors, and they use it. We have a number of hits that we have to the website, so we know that they're using it. We're hearing the stories from them about using it. Well, it can also keep all the stakeholders, the community. It improves all of our transparency. It helps us to manage the workload. We know what's coming in. We know what to anticipate. We have access to reports in the system that we can tell the legislature and the citizenry. Every year we provide an annual report out. It keeps our costs lower because we know how many kits are being used and wasted. We know how many kits are expiring on the shelves so that we don't have to replace those kits if we can get them used in a timely manner. We save a lot of money by ordering the kits at the statewide basis because the hospitals are not ordering them and upcharging for them. We're buying them all at the state, and we're sending them to the local entities. We also try to not run out of any kits. Supply chain issues have been a real thing for us as well. And so we're having to really think about pre-ordering those kits so we can get them in, but making sure that we don't run out of kits so our entities have them to collect. We don't have any personal identifying information in the system. There is no login required. Medical facilities, prosecutors, law enforcement, everybody logs in to do steps to move these kits forward. But as far as the public view, there is no login. We do have one path where we use prosecuted attorneys. So if the law enforcement decides that it does fit under one of the two state statutes that don't require testing, then the prosecuting attorneys have to review that. But all of these entities have their different logins for their different purposes. But again, the victims and survivors, the public, do not log into the system to look at the information. So with that, I'm going to pause and we're going to turn it to Rylene to talk more about the kit tracking system itself.
All right. Thank you, Matthew. So Idaho, when we were developing our sexual assault kit tracking system, we refer to it as iKits. We looked at the resources we had, the funding we had available, and what would work best for our state was to develop our own in-house tracking system using our IT programmers. The first thing we wanted was a system that was web-based and compatible with most mobile devices, recognizing that most people these days do everything on their phones. And so that was really important for us, that it be something that could be accessed easily and quickly. Sexual assault victims are given a serial number for their sexual assault kit at the conclusion of their exam, and that is the serial number associated with that kit that will be associated with that kit through its lifetime. And the victim can use that to enter into the system to see the status of their kit. Where is it at in the process? As Matthew mentioned, each other organization that has a login all have a unique view that they can see based on the information that they are required to enter into the system. And Sherry will be talking a little bit about that later. So what information is tracked? Right now we track a variety of information. And I will say one nice thing about having an in-house program that we developed is that this has evolved since the beginning of our use of this system. Whenever we saw something that we thought we needed data on and needed to track, we were able to add that to the system. We track the exam date, the crime type, those types of things that for all kits. The only victim information that is in this database is whether that individual agreed to be named and report to law enforcement, or if that individual requested an anonymous kit collection per VAWA. In Idaho, we saw a need to track whether a suspect reference sample had been submitted to the lab. So that was an addition that wasn't part of our initial system. We have a section on whether or not a kit meets the submission requirements. As Matthew mentioned earlier, if it's a VAWA kit, an anonymous collection, those do not meet the submission requirements, or those kits where there is evidence that no crime occurred. We only track whether biology or DNA testing was done on the kit. As of right now, we do not track if there was any collection of toxicology evidence, for example, a urine sample for toxicology or a blood sample for blood alcohol testing. We track CODIS, that's the DNA database system. We track CODIS entry, and if there is a CODIS hit, that is also tracked. We also track whether or not that hit was followed up on by law enforcement. And these are all things that a victim entering their kit number, they can see where it's at in the process. They can also see when testing has been completed. They can see if a DNA profile was entered and whether or not a hit was occurred with that sample. This slide is a graphic of the life cycle of a sexual assault kit in the state of Idaho. It starts off with the state lab purchasing the kit. As Matthew mentioned, We do provide all of the kits in the state of Idaho. That's part of our process to ensure a more uniform collection, regardless of where in the state a victim is seeking medical care. So we enter them into the system once they are purchased and received. It will then be sent to the healthcare facility that's going to collect the kits. When a victim arrives and reports a sexual assault, the kit's collected, and that is logged in by the medical facility. Once it's sent to law enforcement, again, that's logged in, so a victim logging in can see when the law enforcement picked that kit up from the hospital. Law enforcement then, per Idaho statute, has 30 days to determine whether or not that kit meets the submission requirements for submission to the lab. If they decide not to submit it to the lab, then the kit would stay with them until the planned destruction date. If they send it to the lab, again, that's documented in the timeline in iKit's program. Once the lab finishes, they will enter the information of when they completed the testing. If there was an entry into CODIS, the DNA database, they will also log in the event of a database hit. Reports are sent back to law enforcement, not through the iKits program, through our laboratory's information management system. In Idaho, the forensic laboratory does not maintain any evidence. All evidence is returned to law enforcement at the completion of testing. At that point, law enforcement will receive the kit back and enter the planned destruction date, and they will retain the kit until that date. And the planned destruction date is another view that a victim entering their serial number can see what that planned destruction date is in the system. So in order to maintain all of this, you have to administer the database. There has to be someone going in and checking and making sure all of these steps are occurring. There's two levels of administrators in the database. The first one is the organization administrator. So those organizations that have a login, the medical facilities, the law enforcement, the prosecutors, and the laboratory. So they can designate their own administrator. They can only see their organization's kits and users, but they have the ability to add, update, and remove users for their organization only. They can see all of their own kits. They can determine who's going to be an administrator. They can determine who will see the notifications from the system and which notifications they would like to see. There is also an overarching system administrator, and that is the iKits administrator that is housed here at ISP. This individual has access to add, update, and remove organizations as well as users. And that's an important feature because we have new medical facilities adding on that are now capable of collecting sexual assault kits, and we have others that are consolidating that are no longer collecting kits. Idaho is a very large rural state, so we also have police agencies that will get absorbed into sheriff's offices that need to be adjusted in the system. The system administrator can also assign organization administrators. This person also, based on feedback they hear from all of the user organizations as well as victim feedback, can suggest changes that we want to the layout of the database. Another advantage of having that in-house homegrown program. Their role is to oversee and support, meaning they're there to help organizations provide whatever training they need, whatever support they need to make sure that they are able to meet the statutory mandates of kit tracking. This person also follows up if they see kits that are not moving. If a kit's received in the lab, but it's still showing at the medical facility, they are able to determine who they need to call to make sure those kits start moving along and those timelines are updated. Again, screen views are different for this individual, more detailed. They can see all of the information in the database. There is also an audit change log or an audit log for each kit. That documents all of the changes that administrator made so that anyone can see what changes that system administrator specifically made to a case. There is also a notes section. They can add notes to what they've done with a kit. And with that, I'm going to turn this over to Sherry Craig, who is our iKits administrator.
Well, welcome everybody. Thank you, Riley, for turning that over so smoothly. So as she was saying, there's different views for different entities. We have law enforcement has their own sections. The laboratory has theirs, medical, the victims or public, and then myself as the iKits administrator. One thing to note, some people feel that this is a complete chain of custody record, and actually it's a timeline record to see where the kid is at as it moves along. And so when the victim logs in, all they need is that number, as Matthew had said they receive in the beginning, and they can find that out. So as a public user, when you go onto the website, which is on our website, the ISP website, you punch in the number of the kit. So in this example, we have kit 496. This screen will show, as you can see in the top right-hand corner, that it has been returned to law enforcement. So this is an instance snapshot of where this kit is at and where it's moving to. This shows the whole overview. As you move down, you have when the kit was created by the lab. It was sent originally to St. Luke's Cares in this instance, which means that's the medical facility that held that kit until it was ready to be collected. Then it was collected. It moved on to the police law enforcement agency. They did their information. Then it went to the lab, and then from the lab it went back. So you have a collection date underneath that, which just shows the date the kit was actually collected. And then we have the status history and the timeline that shows every step. So when it's sent, it gets a sent log in the timeline. And then when it's received at the next entity, it's received, which creates another timeline line. So you can see where everything's at. So any victim or anybody that has a kit number can go to the website, punch in the kit number, and this is what they'll see. As Matthew had said, there's no personal information, there's no names, no emails, no phone numbers, so everything is completely anonymous, and only the person that knows that kit number knows what happened and where this needed to go. So the next view is a medical user's view. So this shows you like 4 different screens on what they have. So this one happens to be a safe ADA. So the first one in the top left shows that they have 2 different tabs, an incoming tab and an in-process kit tab. That is the only tabs that these medical users see. Incoming would be if any kit was sent to them and is waiting to be received, and the in-process shows which kits they've received and are waiting to be collected. As you can see in that one, they all show unused, so they're just in storage for when they're needed. The next one to the top right is the sexual assault. That shows kit number 346. This is the information that the medical users see. This is all they see. They see the expiration date of the kit, who's to the collecting agency, the law enforcement agency that they're going to send it to. There's a collection date, and then, of course, the victim's name or if they want to be anonymous. This is the information that medical users fill out when they have it, and this is all they see. Back over to the chain of custody event, that's the little box that when they get ready to send it, they're able to click on the action. There's a send and receive. In this case, medical would be sending it to law enforcement, so it would be sent. They would be able to click in the date of the person sending it. Generally, it's a user of iKits because that's who has to log in to do this. What organization and what they're with, who they're sending it to. Many agencies, medical, will send them to various places. They don't always send them to the local law enforcement. Sometimes maybe they're collecting a kit for an agency that's either in another state, in that case it would go to out of state, or maybe they're collecting it for the county sheriff or the local PD, just depends. So the 2 can be to a variety of different places. And then again on the bottom right, we have the timeline. So the kit was created at the lab and then sent to the medical facility. Then you have the law enforcement dashboard. So theirs is a little bit different. As you can see, they have many tabs. They have an incoming tab, a pending submission tab at lab, analyze, and not meeting criteria. So they have more information that they can see and more destinations for this kit's moving. Again, the incoming is if the kit has been sent to the entity and it's waiting for them to receive it. Pending submission means they've collected everything and they're waiting to send it forward. If it's at the lab, pretty self-explanatory, it's here at the lab. Once it's been analyzed, it'll show that and sent back. And then if it's not meeting criteria, meaning that the law enforcement doesn't feel that there was enough information, or maybe it was a false claim, or there could be a variety of reasons why they determine it's not meeting criteria. Then the next screen is, again, similar to what the medical facility was able to see, except for this is law enforcement. So law enforcement can see the medical data, which was the collecting medical agency, and where it was sent to, the date, and the type of victim. And then the law enforcement section below that has their case number, the investigator that's doing the investigation, the type of crime, the date, and then the rest of the information that they will need to put in. Meet submission is down there, yes or no, the submission date. As Rylene had said on the circle of the chain of custody circle, when it eventually comes back to the law enforcement, you have that planned destruction date. And that's where they'll put that information in. And when the victim goes to their kit number, they would be able to see that date once it's entered. Moving on, the law enforcement has a couple other screens. Just like with the medical side, there's the regular tracking screen that both the public can see, which this mimics the same thing the public or the victim can see. It has the timeline of when the kit was created, received, and moved on. And then, of course, on the right side, you have the collection date at the top, the status history, and the timeline. So all those are also what the victim sees and the medical can see. So they all kind of duplicate each other. And with that, I'm going to turn it over to Rylene, and she's going to continue on. Thank you.
All right, thank you, Sherry. I'll start by talking a little bit about the lab user view. I am also a DNA analyst and have used this kit program. The lab user, what they see is what they enter is the date that the analysis was completed. They also enter information about whether or not a suspect reference sample was received. Again, that was something Idaho determined we wanted to start tracking in the system. We also enter if a DNA database eligible profile was entered into the system and the date. And if there was to be a CODIS hit, we would enter that date and information about whether or not law enforcement followed up on that. We also have a few notes fields in there that allows the laboratory to enter a few notes. One that we didn't have a slide for, but the prosecutor's view. As mentioned earlier, if a law enforcement agency determines that a kit did not meet the submission requirements, a prosecutor needs to log into the system, document that they have reviewed the file on that case, and whether or not they are in agreement with the law enforcement agency. If they are in disagreement, then the law enforcement agency must still submit the kit for testing. I'll move on now talking about the importance of compliance. We developed a state statute so that we could ensure compliance by all of our user organizations. Everyone that is a login user of the iKits program is legally bound by state statute and required to complete all of those timeline entries and the other data that's necessary for the system. It allows for that timeline to be maintained, and it mandates reporting unless the victim declines by having that anonymous VAWA kit collected. It also provides rights and resources to victims, supports for victims and their families, and of utmost importance when developing this system was respecting the privacy of the survivors of sexual assault. For our medical facilities, our goal is that all kits are collected in the same manner and the same format. It's that concept of uniformity of care, regardless of where a crime occurs within our state. We want that victim to receive the same care that they would in any other part of the state. It's important that our medical providers are specifically trained on the collection process. That's why we have actually the SANE-SART nurse coordinator position designed to train those nurses in proper collection of the kits. The other part of our statute is there is no reporting to insurance. For example, we have adult minor children or college students that may still be on their parents' insurance, but there is no reporting to the insurance. We also encourage the continual training and education for everyone, all of our stakeholders. That's a big component of the ISAKI group that was mentioned at the beginning of this program, is where do we need to improve? Where do we need more training and education to help improve the service and support that we provide to the survivors of sexual assault in Idaho? And finally, the process that we go through for compliance. Continually monitoring and keeping up with organization users. That's something our iKits administrator performs. Unfortunately, there's high turnover in our medical and our law enforcement communities, so we are constantly having to keep that updated. Monitoring kit movements, monitoring that timeline where they sent and received, if there were any errors, if it's a lot of the send and receive our drop-down menus and choosing if you accidentally clicked the wrong agency that it was sent to. So monitoring and making sure that is all up to date. So when a victim logs in, they're getting very accurate and timely information on their kit. Also ensuring that all data is entered. Our statute dictates that victims are notified when their kit is to be destroyed. So making sure that that information has been filled in for all kits, and the continual push to have organizations enter all of the required information. And the other part of our statute compliance, our process, is updates, reminders to organizations about their role in the statute when they have new users coming in to remind them of what their role is and the importance of that role in the process. And then another function is constantly monitoring the legislation and whether or not changes need to occur. And with that, I will turn it over to Matthew to talk about some of the lessons we've learned.
We learned that initial audit to determine what number of kits you have out there and where they are is really important. We learned that performing that independent in-person audit is important. It's critical that if you want to have this software, that you have a development team if you want to use our software or another homegrown software. But IT support is critical all the way along. There will be changes needed as statutes change and other things happen. So if you don't have an IT team in-house that can support this, buying a commercial product might be an option. We didn't. We went in-house because of the cost of the maintenance of the software long-term. But that IT component and considering that is important. We have one full-time dedicated person, and it keeps her very busy to follow up on all of these things. And so having administration locally representing your state, responding to users and administrators of different entities is really important in this process. We have legislation that requires all of these things. It requires tracking compliance. It requires all of these entities to participate in the process, and having a way to hold them responsible to that is important. Probably the most important thing that we learned is controlling the kit intake into the process so we know what is going into the system. That way we can know what the complete system is. We know how many kits are coming in. We know how many are being destroyed. We know how many we have in our state. And other than controlling the intake of the inventory, you have no way of knowing. We developed a plan to deal with the older kits, the ones that were historically on shelves, and we decided to inventory them in our system. I know some people are doing day forward, and I think that approach is fine, but I think you have to decide which approach you're taking. I like the approach we took of going back historically and putting all of our kits into the tracking system, because we do have to maintain those kits for 55 years, and going and doing the work in the beginning was valuable to us. And then our ISAKI group, our state working group, our multidisciplinary team on a state level has become very important to shape laws, protocols, and the other things that we do in this state. We collaborate together to, again, solve these issues in Idaho as they come up, and they do come up. We have had a lot of inquiries about our system. We are happy to provide this free of charge to any public entity. All you have to do is send us an email. We'd be happy to provide this, the link to download the software for your programmers. We provide the programming language and everything that is associated with it. The code all comes to you. You can change it however you'd like it. We hope people will use it. We know several states have gone live with our system, others that have looked at it and modified it for their use, others that have decided after looking at it that they need more IT resources and gone after a purchase on an RFP. Any of those are completely appropriate. We just want to make sure that this system is available to people, that if you don't have another solution or you don't have the funding to buy a system, that ours is available and affordable for you. I'll finish with our contact information so you can reach any of us. Our roles again, I'm the laboratory system director. Rylene manages the DNA laboratory, and Sherry manages the kit tracking system. But any of us are available to answer any of your questions. We'd be happy to talk to you more on a one-on-one basis if you have those questions. With that, we have concluded the presentation that we're making today, and we would love to have any questions coming in from any of you that are interested in addressing any of these topics.
Alrighty, we are going to go ahead and go into Q&A. We have guest moderator Tyler Rabel with us with the FTCOE joining us to moderate. So I'm going to go ahead and turn things over to him.
Excellent. Thank you, Natalie. Hi, Matthew, Rylene, and Sherry. Ooh, putting you all together. How are we all doing? It's great to see you all.
We're doing really well.
I'm glad to hear it. We have a ton of questions, so we're going to dive right in. I hope that's okay with you all. So the first question that came in kind of early, and it might have been explained a little bit, but I'm hoping we can get a little more of a robust answer. So it came in while you were speaking at the beginning, Matthew, and a user asked, can you please explain the circumstances when a kit might be destroyed and when the date of destruction is requested?
Certainly. So we have state law that dictates when a kit would be destroyed. They are not able to destroy that kit until that state statute date. They also, if the sentence is completed by the individual and there are no other complicating factors, meaning there are no other suspects in the case, then they also are able to destroy that kit after all of the case circumstances, the court proceedings are all resolved. So those are all defined in statute, and then they publish that date in the system so that it is transparent to the survivor, and they can challenge that date if they wish to challenge that date and have a remedy of preserving the kit for longer.
Perfect. Thank you for the clarification. And in kind of the opposite vein, you're talking the end of a kit and now the beginning. Rylene, a question came in for you while you were speaking, and an audience member asks that if the kit does not meet the submission requirements, is the collecting organization notified and provided feedback about how to collect to meet full submission requirements?
So in Idaho, the only two reasons a kit would not be submitted, and this is defined in state statute, is if the victim decides to have an anonymous kit collection to be identified as a Jane or John Doe. And in that instance, that's written on the outside of the kit. That individual has an option at a later date to make themselves known to law enforcement and to proceed with testing of their kit. The other circumstance, again, neither of these would have anything to do with the actual collection of the kit. The other circumstance would be if law enforcement has evidence that no crime was committed. And in that circumstance, the kit would not qualify for submission to the laboratory.
Perfect. Thank you. And kind of on the same topic, a user wanted to know what is Idaho's definition of an anonymous kit?
Idaho's definition of an anonymous kit is when the individual having the kit collected says, I do not wish to be identified to law enforcement. I want my kit collected to preserve the evidence, but at this point, I do not wish to be named. And so their name is not put on the outside of the kit and not given to law enforcement. Law enforcement is not called to come and pick up the kit until after that person has left the medical facility.
And in Idaho also, it's important to clarify that we do not allow minors to be anonymous. So they have to be an adult in order to be anonymous in our state, a Jane or John Doe kit.
After the anonymous kit is collected, the survivor, the victim, they can still go forward with engaging with the criminal justice system afterwards, right? It's not a one and done kind of situation.
Absolutely. So if they choose to remain anonymous, then we have a kit retention period that they have the ability to go back and to test that kit later on. We don't test those kits up front like some states do, but we retain those kits for a long enough period that if they do change their mind and decide to participate in the criminal justice process, that we can at that point process the kit.
Perfect. Thank you. We had another user ask if anonymous kits were stored for the same length of time as the reported kits, but it sounds like that's not the case. Is that correct?
Anonymous kits under Idaho statute are stored for 55 years.
Gotcha. That's a lot of time. Perfect. So we had a couple other questions come in through our email inbox. One user wanted to know if there are any reasons why a kit would not be submitted to be tested in Idaho.
It would go to those two reasons. And again, those are in our state statute. If it's an anonymous collection and the victim has not decided to be named to law enforcement, or if law enforcement has evidence that no crime occurred.
Part of that consideration was that in our laboratory, we cannot process samples from evidence into CODIS, into the National DNA Index system, if there's not a crime alleged. So that's the reason why we're not testing those kits that, again, are Jane John Doe kits. They're choosing to remain anonymous and not participate in the criminal justice process yet or ever. If they do choose to participate, then we can process those samples into CODIS. Now, a lot of states have chosen to do that a different way and process those kits and hold them in a state or a local database until the time that that information might become probative. But at this point in our state, we have not chosen to take that approach.
Awesome. Thank you. We're going to shift gears a little bit to talk about some of the technology. One of our audience members wanted to know what type of encryption and data security is used, considering that this is primarily web-based.
It is web-based, and we've taken painstaking efforts to make sure that there's no information in there that's PII. No personal information is in this database. So at most, what they could get is a kit number, a hospital it was collected at. So if you knew someone that was around that time and went to that hospital, you might be able to gather some information about the survivor, but that's just highly unlikely. And so because we're not storing any information that's really that private of information, then we're comfortable with the way that we're doing this. I mentioned in the presentation, we know that this system and any system that exists on a state server or federal server, it's a matter of time before somebody figures out how to hack that. So we do not store any information about our survivors in the system. No phone numbers, no email addresses. There is nothing that they could obtain, even if they could get to the login side. The most they could see is who was the collecting nurse, who was the officer that was responsible to move that kit to the next step in the process.
It definitely seems like it's very secure in that regard. How much does it cost on an ongoing basis to maintain the software?
So we don't have a lot of costs, and that's the reason why we did it the way we did. We had some upfront development costs with our software developers and also standing the system up. But year to year, we maintain it on our servers here at the state police. And so there's not ongoing server purchases and things. We obviously have to purchase new data and servers as we have that need as an agency, but there's no cost directly to this system. We do have a person that's in charge of administering it, Sherry. So we have her salary costs per year that would be to maintain and administer this system. But other than that, there's very limited costs for additional development. We might have a programmer's time to do some changes to the system if we have statute changes or want to make different reports. But all that would be encompassed in their normal day job. And so it doesn't cost us additional to run the software.
So just so I'm understanding this correctly, is that one of the main reasons why you didn't go with a commercial product, was the recurring cost of maintenance and all of that associated costs?
It is. For Idaho, we collect between 400 and 500 kits a year. And so for us, we needed a solution that was going to work with our scaling. And we had just determined in looking at software maintenance ongoing costs that it was just too cost prohibitive for us
to do something like that in our state and for our entity that we were trying to solve this problem for. So yes, it was initial purchase price, which I know a lot of people can purchase that now with grants and SACI money and other things that they might have available to them. But the ongoing maintenance cost was really the consideration for us in knowing that with a 55-year kit retention and really no end to this program in sight, we needed to make sure our software was affordable year to year.
Yeah, I'm sure those costs would really rack up if you're looking at a minimum 55 years of holding onto that information. So when you're bringing in new users into the system, what kind of training do you implement? Are there classes they can take? Is there just some like a slide deck? What's the training for new users look like?
So most agencies, either law enforcement or medical, whoever's in charge, a lot of times with the hospitals, it's usually the ER department. So it might be the ER nurse, or with some of the specific domestic violence centers, they usually have a lead person there, and they determine who they want as a user for their specific organization. When I create that, they also determine if they want their own administrator for their agency. So they have their own administrators that can add, remove, and update people for their own specific organization, and they make that determination. The law enforcement's very similar as to sometimes it's the evidence technician, sometimes it's the chief or the sheriff, because they might be the only law enforcement person there, or it might be all of their deputies or their detectives. It just depends on who they want to have access for their specific organization.
And additionally, for training, there's a help tab, and there are videos for every type of user and the different functions. So someone new to the system that maybe they didn't get training from their predecessor, they can always call in and Sherry can help them, but there are some pre-recorded videos that walk them through click by click on what they need to do in the system.
Perfect. Thank you. As a former teacher, I'm always interested to see how the training and education kind of plays into here. We've had a couple of comments come in from the audience that I just wanted to share with the three of you. So one user commented that it's great to see that the DA is part of the review for which the SACs are submitted and not submitted. And then another user said that it's an excellent privacy protection to restrict info from the insurance companies. Wonderful. So people are really enjoying the content. We've had a couple more questions come in the meantime, in between time. So Matthew, a question for you was a user asked, is there a training program for healthcare facility staff regarding sample collection and packaging for the sexual assault kits?
Yes, and I'll maybe give some publicity to a webinar that we did in January for RTI and for the FTCOE, talking a lot more about that same training program that we have here in our state. So we do have one dedicated individual, a forensic nurse, a SANE A certified nurse, who reports through the forensic services chain of command. And I think that's unique in the country to have that nurse in that reporting chain with the laboratory integrated into the laboratory. She does training. In fact, she's training one of her 10 weeks that she'll be training this year. She teaches a 40-hour course that's certified by IAFN and also by the Montana Association of Nursing. So they get certification hours, they get continuing education hours, and we also are able to train around the state, especially in our rural communities, nurses and medical providers to do a better job of collection and to do a better job of healthcare to the survivors of sexual assault in our state.
Excellent. Thank you, Matthew. And I'll have one of our technical support staff post the link to that webinar in the chat so that anybody interested could check it out. Unfortunately, we are not going to get through all of the questions, so I wanted to make sure that I give you all an opportunity to share some closing thoughts. So if there's anything that you want to reiterate or any points you want to drive home, now's a chance. Matthew, if you'd like to go first.
I would just like to say the reason why we invested the way that we did was to make sure that this could be done in every community, in every state, that there was a low-cost alternative or a no-cost alternative to be able to track kits. We recognize the importance of this project, so we invested so that others can benefit from the investment that we made. If you have more resources, that's fantastic, and there are commercial products available. But at the very least, there is a product available at low cost that you could use to implement this immediately to make a huge difference in your state or location.
Excellent. Thank you. Sherry, Rylene, was there anything else you'd like to add?
I'll just add that if anyone's looking to implement sexual assault kit tracking, a couple of the most important features that I think we integrated into our system is thinking of the survivor and the access to the information to help them know where their kit is at in the process, to give a little bit of power and control back to that individual. And also for the users of the software, everybody's busy, everyone has a lot on their plate. And so it was really designed, and as a daily user of the program, I can say it's very easy. It takes me very little time to go in and enter the information. It was designed to be very user-friendly and minimal amount of time to enter the necessary information. So I would recommend finding a system that keeps those two things in mind.
Perfect. Thank you. With that, we are going to close out. So unfortunately, once again, we don't have time for all of the questions that came in today, but feel free to reach out to our presenters for any additional information. Matthew, Rylene, Sherry, thank you so much for spending time with us today, taking time out of your day to put together this presentation and to share all of this valuable information. For those of you listening, our audience members, thank you for joining in. If you could take a second and fill out our customer satisfaction questionnaire, that would be excellent. It really helps us kind of gear our upcoming presentations and make sure that we're getting to the best information possible and addressing all of the needs in the community. So thank you all for joining us today, and we'll see you soon.
Before you leave today's webinar, please participate in our short 5-minute survey. Simply click the checkbox icon directly above the chat to access the audience feedback survey for today's event. Your feedback is critical information that helps us improve our webinars and continue providing the best experience possible. We would greatly appreciate it. Lastly, across the top of the live stream window are links to our social media profiles, including Twitter, LinkedIn, and Facebook. There is also a link to the FTCOE website, the Just Science podcast, and the FTCOE newsletter registration. Like, follow, or subscribe to stay up to date with everything the FTCOE is doing in support of the forensic community. Thank you again for attending, and we hope everyone has a great day.